In today's health headlines, is acetaminophen use during pregnancy really linked to developmental disorders? Scientists pushing back on an FDA-approved genetic test and why some women are missing mammograms. Joining us now is Chair of Emergency Medicine at Yale Medicine and Professor at Yale School of Medicine, Dr. Arjun Venkatesh. Thank you for being here, Doctor.
Hi, thanks for having me.
All right, let's start with this new study that has found that taking acetaminophen during pregnancy is not linked to an increased risk of autism or ADHD. What do we know about that?
So acetaminophen is the same thing as Tylenol, and unfortunately for several years, women and obstetricians have really struggled with recommending its use during pregnancy because of fears that it could cause ADHD or autism. That was based on what was probably limited or even flawed data. A new study came out this week that was done very well, included 2.5 million children born in Sweden, looked at the medications they got, and what they found is that using Tylenol while you are pregnant does not increase the risk of autism or ADHD or other neurologic disorders, and that it was probably because we weren't measuring the genetic risks in families that we were missing this and sort of making the wrong recommendation before.
All right, good news. The FDA approved a DNA test to predict your genetic risk of opioid addiction, but some scientists now are pushing back, asking them to rescind that approval. What can you tell us about that?
Yeah, the opioid crisis has only gotten worse in recent years, greater than 100,000 deaths a year across the country. And so we're looking for answers wherever we can find them. There was a test that was approved by the FDA, and it's important to recognize the difference between an approval for a genetic test and something that might be clinically useful. What the test does is it tries to look for some genes that may be associated with a higher risk of addiction. The fear is that somebody would use that test then to potentially not prescribe opioid medication when somebody's in pain, or more importantly, to think that somebody's not at risk of having an opioid use disorder who is, and they wouldn't get access to treatment. And so it's important to not sort of find these genetic tests, take them as the rule and just run with them, but actually to really make sure you speak with your doctor about these tests and, potentially not even get them if they don't make sense for you.
Okay. Another new study says lower income women in this country are more likely to miss their mammograms. Tell us about that and why it's happening.
Yeah, data came out from the CDC. They looked at mammogram rates around the country in a variety of areas, and they found that lower income women were much, much less likely to get mammograms, and that it varied by state to state. Over 70% of lower income women got mammograms in Rhode Island, fewer than 50% in a state like Utah. And so it's driven by a lot of things. It's hard to get off work if you're lower income to be able to get a mammogram. You may have challenges with insurance coverage for a mammogram. You may have a variety of other things that make it more difficult to access health care, but it's an important test because it's one of the few things that we know can have a real preventive benefit for women. It's recommended fairly universally, and so it's really going to be a gap that needs to be closed in the coming years.
It's important. Dr. Arjun Venkatesh from Yale, appreciate your time. Have a great day today.